Hello everyone, I just wanted to bring you some information in this video about some things that we've been recommending here, both in the Center for Nutrition and Wellness and Upper Perth Chiropractic Center, that you can do almost preventatively. I don't want to say that it's going to keep you from becoming ill, but there are things that can be done to bolster your own internal immune function. And so I'm going to go through a series of things that I've been recommending. The first is vitamin D. Now, the dose on these would have to be determined individually, but I just want to give you the supplements that I'm recommending to build immune function. Vitamin D obviously is very important. Most individuals in the United States are deficient in vitamin D, and we usually determine that in a blood test. But there are prophylactic doses that can be taken on a daily basis. The Vitamin D Council generally recommends between 2,000 and 3,000 international units of vitamin D on a daily basis just to maintain your level of vitamin D. However, therapeutic doses can go much above that. So that would be number one issue, is vitamin D. Number two, which I'm sure many of you have heard a great deal about, is zinc. Now, zinc has been used for years to fight off viral infections like the common cold, which is also a COVID virus. But zinc doses will vary depending on needs of the body and the individual. Right now in our office we're using a couple of different forms of zinc, one of which is a 50 milligram dose. But I vary that based on the needs of the patient, and that's very important for you to remember. I'm not trying to give you exact doses in this video. I'm trying to get some information across to you about what you can do to help build and bolster immune function. The third thing that we're using is vitamin C. Now, vitamin C has been studied for really decades. Linus Pauling did all his studies back in the 60s and early 70s on vitamin D, and he used mega doses of vitamin C. Vitamin C has been used as an infusion in very high doses to treat a variety of different conditions, but we're using oral doses, obviously. And what I use here in the office, again, is a 500 milligram dose, which I vary, okay? So we can dose up or dose down based on the needs of the patient. But vitamin C is also one of those components that's very important. The other thing is something that people don't seem to know a lot about, and that's quercetin. Now, quercetin is a strong antioxidant, but quercetin also has a tendency to drive zinc into the cells. So we've been using quercetin here, and I take it myself, to bolster immune function, particularly in these times when we're trying to avoid or combat the potential of dealing with some of the viruses that are circulating right now. So quercetin that we use is a 500 milligram dose. Frontline doctors are recommending a 250 milligram dose, but again, the dose will vary depending on your needs. So I'm not telling you a specific dose to use. I'm just exposing you to those supplements that I feel would be beneficial for most individuals to use to kind of bolster immune function and be able to ward off the potential that they're going to have a severe viral infection. So those are the four main ones. There are others like melatonin that can be used and other such supplements. But for right now, I think if you could use those four supplements, vitamin D, C, zinc, and quercetin, I think that would go a long way in bolstering your own immune function and assisting you in being able to fight off and ward off some of the potential viral infections. And you know the big ones right now, obviously, but there are others that will help you with as well, like the common cold and the flu virus in the fall. So hopefully that you find that helpful and useful. If you have specific questions about dosing, you can certainly call the Center for Nutrition and Wellness at 215-679-WELL or 9355 and get a little more detailed information. I can always do a consultation with you, whether that's via Zoom call or on the phone or in person here in the office, and go over that information in detail. All right, have a wonderful day, and we'll look forward to bringing you more information in the near future.